Hello and welcome to this COVID-19 update for you and your community here in the Bass Coast, presented by Bass Coast Health. Today I have a few people as we talk PPE, personal protection equipment. Claire Mason, who is the theatre manager, is going to tell us first about the equipment. Good morning, Claire.
Morning, Kevin.
So tell us about this equipment, PPE. We hear a lot about it in the media, and I presume we're going to hear a lot more about it. Who's this, by the way?
Oh, we've got Josephine modelling for us today.
Josephine, good. Now, you're a theatre manager, which means you're in control of the use of all of this equipment. I presume it's being used a lot more than it has been in the past.
Yes, absolutely. Right across the health service and different levels of PPE. So we see Josephine today with a hairnet on, goggles to protect her eyes, a mask and a plastic gown.
We hear a lot about the masks. Let's go through the masks that Josephine is wearing and some of the other ones you have for us.
Yep, sure. So Josephine's wearing our general mask. You'll see a lot of our nurses and healthcare providers right across Bass Coast Health wearing those if you should present to our clinics, to emergency. And it's the very basic one. And then the other one you're probably hearing about in the media is the N95. And it's a greater filtration mask for the viral load. So when we think of the virus, it's the mask that we'll be wearing. Okay,
so are more healthcare workers at Bass Coast Health wearing protection masks now than they would ever have been?
Absolutely, yes. So as the health service gears up to deal with both the flu, the cold and possibly COVID-19, you'll see most healthcare professionals wearing a mask.
And when is the determination made to change from this mask to the more appropriate mask? Do you wait for someone who looks like they have the symptoms of COVID-19, or do you wait for you to find out that it's actually a case?
So it would be if we were dealing with someone's airway and we were looking at the virus becoming an aerosol virus rather than a droplet virus, then we would go to the greater filtration mask. So this would provide general protection, even in the ED.
Yep. And you brought some gloves here. They're most important and vital almost in this day and age.
Absolutely. You would always see your healthcare provider popping gloves on, and we've got just a standard glove here, and we've got an extra long glove as well, heavier duty, just for different uses.
Is the level of anxiety rising in the department in preparation for what may come?
I think healthcare workers are anxious, and rightly so, but I think with good planning and preparation, that relieves some anxiety, and knowing that we've got equipment to protect us is the important thing.
That's really the safety net, isn't it?
Absolutely.
Thanks, Claire. Jeremy Hall is going to be joining us right now. He is in charge of supply of all this PPE, personal protection equipment, at Bass Coast Health. G'day, Jeremy.
Good morning, Kevin.
Thanks for being here and contributing to a bevy of cast members today, including, what do we call her? Josephine. Not tonight, Josephine. Jeremy, so the supply of PPE, it's very important that we are ready to be prepared for anything that ensues over the coming winter. How is supply now, and where are we looking for in the future?
We're in a good spot at the moment with our stock of PPE, but as Claire was talking about, preparation is key of what may come our way into the Bass Coast region. So we're reaching out at the moment to anybody and everybody that may be able to help us supply some extra stock.
All right, we'll get to that in just a tick. You may be able to help, so stick around. Also, tell us how much the supply that has come from the regular suppliers has increased over the past weeks.
So since obviously late last year,
yes,
COVID-19 coming on the radar, we've definitely been preparing more and more and increasing our levels and our orders for personal protection equipment for our staff at Bass Coast Health.
Mm-hmm. And is it your job to keep a daily tally of that, or is it done on a weekly basis, or how are you gauging that supply?
So myself and my staff are constantly monitoring what's coming into the department and also what's being used, what's going out to the departments within the hospital, and how much has been consumed.
Right, and it's readily available to all staff, isn't it? I mean, there's not a restriction.
Absolutely.
Right, and if you do present to the ED or any other part of the hospital, even to the front desk now, or even before you get into the hospital, you will find staff members wearing this particular mask. And that'll be even more so as the winter goes on. Let's talk about how you might be able to help Jeremy and his team at Bass Coast Health to supply some PPE that you may have around your place, and you'll be surprised that you just may have some.
Yeah, so we're looking for people in the community and the Greater Gippsland region to help us with any gowns, gloves, masks, hairnets, eyewear that they may have in their businesses or at home, other organisations that they may be able to donate or on sell to us.
Who would have this sort of stuff? I mean, I can't imagine anyone having a box of them in the back, but you never know.
Yeah, that's right. We've seen donations already from hairdressers and nail salons. We've had some asbestos companies that have given us some really good donations. There's building supplies, panel beaters. There's lots of companies out there. Men sheds, stuff like that may just have them that aren't using them, and sadly with businesses slowing down and some closing down, they may have stock that they can pass on to us.
I know there's a group of people also getting together to sew and make some of the hairnets, which is a great initiative as well.
Yeah, absolutely. It's fantastic that people are donating their time to help support and help the organisation prep for what may come.
Right, it gives you something to do in these days of personal isolation or distancing. All right, how do people get in touch with you, Jeremy, to help out?
So best way to get in contact is that they can call us at the hospital on 5671 3333 or 5671 4203. Or if somebody wants to email the supply department to myself or my staff, that is supply@basscoasthealth.org.au.
So those numbers, you can see them on your screen, 5671 3333, that's the hospital itself. To get right through to supply, it's 5671 4203 and supply@basscoasthealth.org.au. And who knows, you may really be able to help the hospital out to have a plentiful supply of PPE to face the storm that may be impending. All right, Jeremy, thanks for being with us.
My pleasure.
And thank you to Claire Mason, and also thank you to Josephine. Please help out if you can. The numbers are still on your screen, and until I see you again, take care.